Hey Julie, this is Frank. I just watched your video. Actually, I watched it and put it on YouTube, but then it didn't work for some reason. I'm not sure what happened. So I'm just gonna do a quick synopsis of what I went over real quick, put it on there. Maybe it'll load faster. I'm not sure what happened. So take two, right? Okay, so when I was watching it, I noticed the first thing that you came in and introduced yourself to the patient, did hand hygiene, that was good, but you forgot to check the chart. Things are going to happen. We're going to make mistakes. I made some on mine. Don't worry about it. Probably another thing I noticed was, it doesn't really matter in the video, I'm sure, but just keep in mind in real life, before you shake the patient's hand, probably do the hand hygiene. That would probably make sense to do it that way. I wrote down a couple notes just because I want to burn through this thing. I already did it once, and I don't want to make another 15-minute video. So, keywords that we want to use when you're assessing the head. You said a few things look normal. Maybe we could try using words like normal cephalic, macrocephalic for a large head, microcephalic for a small head. You did state that the head was symmetrical and everything, and that it looked normal. So I knew what you meant. I'm not sure what they're looking for, if they're looking for those words, something that they had said on their paper. So keep that in mind. I didn't see temporal artery checks. The TMJ, you didn't state that that was cranial nerve number 5, or there's any clicks or popping sounds with it. You did a smile test, which is good. Part of that test, try to remember, is a frown and a puff. And when you do that, then you would say cranial nerve number 5 is intact, or that it's not intact if there was an issue. You did a good job on your range of motion. And maybe, I don't know if we have to add lifting shoulders for that, because I thought range of motion, for the neck really was just the neck, but I could have swore at some point they said something about lifting your shoulders. I think I did in my video. I'm pretty sure I did. I don't know that it's right though. Cranial nerve number 11 though, when you're doing the range of motion, just remember that. You did a good job with the thyroid. I saw you did do the whole check on it. Typically we would do it from behind, but you had a bookcase there, so I understand. I think the point of the video is that you did it and you knew how to do it, so I think you're fine with that. Synapsis of the lymph nodes. I noticed I think you completely forgot the tonsillar one, and in mine I think I called it the thyroid or something. I messed mine. I don't know. I knew what I was talking about, but I think I just said the wrong word on accident. But now when you were pointing those out, you said what did you say it was? It was a superficial chain. I don't know what that is. I think you mean the chain maybe was this or something, but superficial cervical, and then the posterior cervical was just a little bit lower, so here, and then supraclavicle, you find your clavicle, and then it's in that dip right in there. And then the deep cervical is, you have to kind of lift up that trap muscle right there and get underneath in that. It was hard to tell because the camera doesn't follow either one of us around, so it's kind of hard to tell. You probably were in the right spot. The only one I didn't hear was the tonsillar. So, but then again, it was hard to hear in the video. I actually had the headphones on and I was recording it and watching your video while I was commenting on it and stuff. But I just want to burn through it, like I said. Remember when you did the mouth check off? You did a couple things and then you went to something else, came back and got them all. That's good. You caught them all. That was good. Again, cranial nerve number 7 was when you stick the tongue out. You did have them stick the tongue out, but I didn't hear you state cranial nerve number 7. And then just keep in mind that I know we don't have to gag anybody for the video, but you might want to say gag reflex number 9, or cranial nerve number 9, gag reflex is intact. Just to say it. I mean, nobody wants to gag there. No one's going to want to do a video with us again. All right. The nose, I thought you did a pretty good job. Throughout the whole thing, your subjective questions were pretty good. There's actually a couple things that I picked up on that I never even knew, such as like an eating disorder with the teeth and stuff. I thought there's quite a few good things I learned from your video actually that I didn't know. Oh yeah, you didn't do the smell. You mentioned the smell. It was a subjective question, and that was awesome. At that point, instead of maybe giving them something to smell, we could just say cranial nerve, since cranial nerve number 1's intact. I don't know. I thought you were going to come back and get all your cranial nerves, and I think you just missed some of them. But that's a lot to remember, I understand. Ears. You did push, pull, push. You did symmetry. You checked auditory canal. You did everything I thought you were supposed to do. It didn't sound like there was any indication to do a whisper test, so I think you're fine with that. So at that point, I would just state cranial nerve number 8 was intact. Let's move on. The eyes. You checked. I checked through step by step on everything. You got everything on the eyes. You palpated everything you were supposed to. Again, I liked your subjective questions. Those were good. I think you were fine with your eyes. Although, you did a good job with Perla. I think you even identified what everything was in Perla, which I liked. But cranial nerves 3, 4, and 6. You have to say those. The only one that we don't have to say, I think, is cranial nerve number 2, and that's like a vision test. I actually think I had that wrong. I think I was misunderstanding what cranial nerve number 2 was when I did my video, and I said it wrong. So, like I said, I had things wrong too in mine. Let me see if I missed anything here. I think I got it all. Normal cephalic, temporal artery, TMJ joint, cranial nerve number 5. Yeah, cranial nerves were the big thing, I think. Yeah, I think that was it. Mouth. Oh, I like the tonsils that you did. You stated what they were. Like the difference between a +1, a +4. You said she was a 2, and explained what that was. I thought it was pretty good. My son didn't have tonsils, so I just when did you have your tonsils out, kind of thing. So, but I stated that they weren't there. So, ears, like I said, number 8, and yeah, eyes. So basically, the only downfall I saw was. It was a pretty good video. It was simply, I check the chart before you come in, ever do hand hygiene before, and then just keep track of all your cranial nerves. And, there's a lot to keep in mind. Maybe have a system to go through everything step by step. I don't know. It's going to make more sense as we go through all the processes. We put them all together in one. And when we do head, we'll just do everything that encompasses the head all at once. It'd probably be easier once we do a full body checkoff. So, all right, that's all. Good job. Don't worry about the sound quality. I heard it just fine. I used headphones. It is what it is. You got the job done. So, good job. All right, peace.